All right, so let's talk about the next big topic, exercise. And it's everyone's favorite, and it's difficult, if you are not an exercise kind. But the least is 150 minutes per week if you can do it. And some of the seniors listening to our show, they have arthritis, they have different limitation to doing the exercise. So what I tell them is something very simple. I say, whatever your capacity is, add 5 more minutes to it.
Right.
Everyone can add 5 more minutes to their capacity. So let's say you walk with a walker. Fine, you can't run, but add 5 more minutes to your walk. So, and then add 5 more minutes after a month. So by the time a year comes around, you'll be doing 30 minutes, and you'll have less falls. Your sugars will be better. Your less hip fractures. And it will help you with your mentation. Make you have more endorphins. So the exercise is again the recurring theme I get from every specialist we
Right.
get on the show, other than the plant-based diet. You want to
Sure.
add something, Venkat?
No, absolutely. Yeah, this is obviously not anything new. That this is we know all of this. Like you said, how do you tailor this to your own needs and not get too worried that, oh, I'm not doing the 150 minutes a week, or I'm not doing aerobic exercise on the treadmill or elliptical. But like you said, how do you just increase your physical activity? Like just walking, walk until you throw a sweat, or some sort of stretching, and whether you do, and we will get into a little bit of meditation, yoga, and that kind of thing. But if you come, I think the best way to do it would be to combine two or three different types of exercises, whatever you can. Um, Obviously, going to the gym helps if you can, and having a personal trainer if you really can afford that. So all those things will keep you on target. But I just wanted to point out how it is important to combine a few different forms of exercise so that you can hit the aerobic capacity and also the muscle resistance and everything with the skeletal muscles.
Right, and a lot of seniors are on Advantage plan, Medicare Advantage plans,
The silver
and they
sneakers, yeah,
they provide either Silver Sneaker or something similar,
right,
and which is free. And the amazing part about those programs is they can join more than one program, so they
right,
can, if they like the water aerobics, let's say you have arthritis or issues of balance, then you can do water aerobics, let's say at LA Fitness, and then do a group class somewhere else, where they do a good group class for seniors. So, and then you can do a Tai Chi at another center. So you can mix and match, and Silver Sneaker is fantastic. It's just that you need a partner, and I
right.
always encourage, patients to go with a partner so they can push each other. I think that then they can maintain their goals for exercise.
Absolutely.
All right, let's talk about yoga. I know you're a big yoga fan. I'm a big yoga and breathing exercise fan. How does it correlate with the management of diabetes, Venkat?
I think, just the slide, I just want to point out how it affects both the body and mind, and specifically looking at the insulin secretion, how it is very hard to imagine, right, how yoga practice can increase insulin secretion. And studies have shown that time and again, that it increases insulin secretion, decreases insulin resistance, and also decreases the sympathetic drive. So our stress levels come down, so cortisol levels will come down. So you would see that your insulin, whatever you make and whatever medications you take, if you're on medications, will be more effective. And of course, it improves your quality of life and mood, and helps your all the other parameters which are associated, including the body weight, blood pressure, heart rate, and lipid profile. So I think this one thing, if you can, if like you mentioned, with all the limitations that our seniors have, in terms of doing vigorous exercise, this is certainly something which I think we'll increasingly see, not only for people who are earning to have peak performance and clarity of mind and everything, but also for patients with comorbidities, and including diabetes, to get better. I would say 80-90% of my patients, when I talk to them about weight, they talk about diet, how low calorie, low carb diet, they're little not eating anything, and they exercise like whatever they can. They're just doing, going to the gym, personal trainer, and everything. And they talk about stress, and we talk about that a little bit. But then when I hit the word sleep, that's when they have an aha moment. And I ask them, okay, how much are you sleeping, and what's the sleep like? I barely sleep 4 hours a day, 5 hours a day, max. So I think sleep has a big correlation with weight, and as a result, all the other associated problems which come with weight, including diabetes, and obviously, I'm sure you see a lot of this a lot. So I think any focus, that's where the practice like yoga, exercise, meditation, um, and just trying to have a community along with you, working with a community wherein you can like a Facebook group, or some form of community you have will help a lot cope with this illness.
Right. So, it's a complex disease. There is no simple answers, as you are pointing out. It's involve multiple organs. So and other thing I tell my diabetics, I'm pretty sure you tell your diabetics too, is it's a marathon. Maintaining diabetes is not a sprint.
Absolutely. Right.
So don't get overwhelmed that I need to change the diet, I need to change my exercise, I need to improve my sleeping pattern, I need to drink more water, I need to take my medication. Yes, all
Right.
that is important, but start with one step.
Right.
Add 5 more minutes of walk. Everyone has these Apple watches now. I don't have Apple Watch, but everyone has some form of Fitbit or Apple Watch, and just set up a simple goal. That I'm going to walk 2,000 steps a day. Start with that. Start with, not worry about what you put in your mouth. Start with just adding 2,000 steps a day. Just take, park your car away from your office or your, hospital, wherever you work, and take that extra steps instead of parking right next to it and go 10 times looking for a parking.
Right.
Start with that, and takes staircase. If you go to your office and if it's safe and it's clean, take a staircase instead of elevator. So now you're
Absolutely.
combining exercise as part of your daily routine, and if you do that, then you will stick with that kind of routine, and it's become part of your daily habits instead of finding time for gym. So I think just doing that, I've seen, will lead to you picking better choices when you go to a restaurant, because you say, "Gee, man, I'm spending 2-3 thousand steps. Let me not have the bread now."
Right. Right. Yeah. One leads to that. They're all linked, isn't it?
Right.